Why do you guys think that pediatric asthma is undertreated?
I personally, in my practice, both inpatient in the hospital and outpatient in my office, think that parents have a really hard time with giving their child medication daily for an unknown, perhaps forever period of time. It takes a lot of time sitting with them and explaining the why behind these things we recommend so that they understand that this is preventative, so their child doesn't end up in the hospital again or can play the sport that they want without having to stop or slow down. And that just takes more time than most doctors have. And that's unfortunately the system that we're in. We have to fit in a lot in a short period of time. It's hard to know if a child has asthma when they're little. We see so much wheezing and trouble breathing for other reasons, and we try not to label them with a chronic illness if we're not sure. So it takes some repetition of wheezing and trouble breathing over time before we feel like we can say, okay, yes, this is asthma. Because there's no
Yeah.
one diagnostic
Yeah.
test. If I had PFTs,
Right.
pulmonary function testing, that would help.
Yeah.
Yes.
It's definitely very hard because, again, like I said, the whole reason I started seeing peds again was just because of that. And, now seeing more and more 5, 6, 7 year olds with asthma, I do spend a significant amount of time talking to the parents. And I'm like, listen, this is what's happening. This is what's going on in the airway. This is the inflammation that's taking place. This is why your child needs to be on persistent therapy. It's an education thing, I think. I think it's a disease state awareness type of thing.
I would agree. I think if we dive deeper into the process of training, the opportunity and emphasis, for example, is not on diagnosis of asthma, not really. If you were to look at, for example, how pediatricians are trained, who trains them, what the training process is like, there's really very little rigorous education around diagnostic criteria for asthma, for example. We could go survey 100 residents right now. Who do you think could list the NIH diagnostic criteria right now?
Please don't
Um,
ask me.
So a lot of physician training, many people don't know this, during what's known as our residency is about providing a service to a given hospital. That service to the hospital doesn't always align with the education that would be optimal, for example, for accurately diagnosing asthma in a practice.